Welcome to The Nation. I'm Gerard RATNAM. Datuk Dr. THIRUNAVUKARASU RAJOO, President of the Malaysian Medical Association, joins me to talk about medical coverage and how it is strengthening national priorities at this point, or national conversations here in Malaysia. Datuk, thank you so much for doing this, and thank you for taking time off to be with us. I know everyone now has got their work cut out for them, especially those in the medical fraternity. Now, the government says MHIT or MHIT reforms are meant to strengthen how healthcare is funded in Malaysia. Now, based on what you're seeing on the ground, people you're speaking to, is the country moving in the right direction?
Okay, thanks Gerard. That looks simple question, but it needs lots of explanation a bit. So what I would say is that this is the first time actually the government has taken an initiative. If you look at it, you have the Ministry of Health, you have the Ministry of Finance too, and also the Bank Negara itself involved in this particular thing. Is all because in the last year, 1 year ago, there was a lot of issues raised even in the parliament about the escalating medical inflation, and then the premium were going up, shooting up. So there were a lot of issues were raised. So to address that, that is when the government, like the three of them, stakeholders came together to ensure that this particular thing is addressed, that is Malaysian Health Insurance and Takaful. So definitely it is the right direction. At least they're taking initiative to address this issue that has been brought up and discussed in the parliament.
So you say the escalation in or inflation in insurance or healthcare within Malaysia. Now, can you give us some context as to what this is, for those of us who don't understand what the game is, or how this is playing out? Can you give us an understanding? We know that our bills are going up, but we don't understand why.
Okay. Basically, if you look at it right, okay, the reason why the bills are going up, okay, the perception is that it's very expensive. But why it is expensive? So we must understand the cases, the complication of non-communicable disease on the rise, aging population, and the regulatory cost is going up. And then apart from that, we also see modern technology being used in the delivery of care. So all these things has compounded for the increase in the cost. And the other thing is that during COVID, so we had a period of COVID whereby we had a lockdown, so sedentary lifestyles, so many things would have contributed. So after that, there could also be an increase because many of them never go for treatment, okay, delayed treatment for those elective cases. So suddenly we see a surge. So these are the reasons. So definitely there was these are all the compounding factors why the cost has gone up, especially in the secondary and tertiary care.
Secondary and tertiary care, yes. it's gone up. In primary care, it's still manageable.
Primary care, I would say the cost is still manageable, and most of the time, if you look at the primary care, if you look even at the statistics by the government done studies in 2015, a person visits a GP clinics only 3.9 times, or private outpatient clinic, yeah, government or public, private sector is 3.9 times in a year. That means they just go 4 times in a year. And then if let's say an average encounter is around maybe 80 to 100 ringgit, you're talking about just spending maybe 400 ringgit or 500 ringgit a year for a person if they want to have access. So that is why primary care is okay. I would say of course our operative cost has gone up, but in terms of the increase in the inflation, definitely it's not as high as what happens in the private hospitals.
Now they say that the government is doing the right thing by planning now instead of waiting until the system is already under pressure. Isn't the system already under pressure? And do you think it's a little bit too late, or there's still time for us to figure this out?
Of course, if you look at the healthcare itself, right, so a lot of issues in healthcare is a legacy issue. It's a systemic issue. You cannot have a short-term solution. So that is why in the health white paper that was passed in the parliament a few years ago, we identified 4 pillars. Okay, so one of it is finance reforming the finance part. So of course that is an ongoing process by the Ministry of Health. Of course we need to address the issue of attrition, the manpower attrition rate, right, especially in the public sector. So public sector has to be continuously strengthened because that is our safety net. We need to increase the funding. So that is where we, as the public, as the member of parliament in the parliament, they need to put the pressure so that the Ministry of Finance, the other sectors must support the Ministry of Health so that the contribution from GDP to healthcare increase. So MMA has been pushing that at least we must have a 5% from GDP for public health spending. So that is something that it must be pushed from the top, from all the ministries. So healthcare is a whole of nation, whole of society. So we need to make sure our public health system is sustainable, because what was the system was that, if you look at the system currently, in the 1960s we were to address maternal mortality and also infant mortality, and we have achieved it very well. But now, can the current system take to the future? Increase in NCD cases, its complication, aging population with technology. So definitely we need to have a different approach, of which we know the government is trying to do that. But then we have to do it fast, including embracing digitalization in healthcare. So these are the areas where
but how much is that going to change if we embrace digitalization? Is it going to make it a lot more affordable? And having said that too, let's also take a look at things that are important, that must be protected for patients, like, say, affordability, access, quality of care. And maybe you have a better idea of what this is, because what I'm mentioning here, affordability, access, quality of care, is all just very basic, skimming the surface ideas or things we need to work on. But I'm sure that there are more in-depth things that need to be looked at this point.
Definitely. I think when we talk about healthcare, right, I think what is very important is that accessibility, equity, affordability and quality of care is very, very important. So for us to do that, of course in Malaysia you have a dichotomous system. You have the public sector and you have the private sector. Okay, and you can see the public sector, 70% of the public, they are using the public sector. Definitely public sector is burden. And if you look at the private sector, it's underutilized. You have the number of beds, and then you also have, you've talked about GP clinics, we have around 11,000 GP clinics in the country. So definitely they are underutilized. So there are ways where the government can offload. That's one thing. Okay, second thing is that by embracing digitalization, let's say for example, a patient goes to a GP clinic for blood test, or they go to a hospital to do a CT scan, and let's say if they are referred to the government facility, is it necessary for us to repeat the CT scan and the blood test? When you have a system where you have access to data, of course with the patient's consent, you minimize this cost. So there are a lot of wastages, especially in the healthcare, when you do redundancy blood tests, investigation, that can be cut down.
Right. I don't know if you can answer this, but how far are we from realizing, or getting access to healthcare data, like say my healthcare data is available to all doctors in the country?
Okay, to be fair to the Ministry of Health, I think even the press statement that was released by the both ministers a few days ago, we can see the digital agenda, whereby they're already working towards setting up a platform whereby you can share imaging for CT scan, X-rays, MRIs within facilities, which is a very, that means they're already working on that. And if you can see the Ministry of Health also, they have actually sharing the data to the patients through the MySejahtera app. And they've been doing that. And I think many of the clinic kesihatan also has been connected, and then the patient, the record can be accessed by another doctor with the consent of the patient. So all these frameworks are already done and is moving. We can see based on what Ministry of Health has been publishing, and they have been working towards that. Now, how do we break the silo between the public and the private? So the low-hanging one, like what was announced the other day, was that the imaging.
Right. So imaging is a low-hanging fruit that we're looking at or working on at this point. Now, some years ago, or when Dr. Zul was minister, prior to him coming back, he talked a lot about primary healthcare. He talked a lot about how GPs can help solidify or strengthen the system by talking about being a first responder to mental health care, things like just past COVID, we had lots of these problems. Have we seen a big change with regards to that?
Of course, it's not to our expectation. But having said that, I think recently the GPs, we managed to get the consultation reviewed after 33 years, thanks to the Minister of Health. And the first time the review is that 10 to 80 ringgit, and then of course now we're waiting for it to be gazetted. And the Minister promises that either by end of this month or next month it will be gazetted. So at least there's one part of it. And also of course getting the GPs involved in the government programs. They've done PKB 40 and then previously Scheme Perubatan Madani. And then more than that, what MMA has also proposed that for them also to push to allow GPs to do all the vaccinations. If you look at the public sector, as I told earlier, 70% of the population is utilizing the public sector. Definitely they are overstretched, right? With the limited, underfunded, understaffed and overworked, right? So definitely that simple cases you can actually offload to the GP clinic, vaccination. And now they have this MySejahtera and MyWA system whereby you can have a central database on that part. Okay,
Right.
and then apart from that, health screening. So they're also doing health screening. So basically, what we can do is that the clinic kesihatan or the government facility, they can focus more on a complex and complicated cases, and offloading.
Give
the
me an
other cases
example
to
of a complex and complicated case.
For example, non-communicable diseases, patients with diabetic, hypertension and cholesterol. If let's say they're coming with complication, kidney, they have a renal impairment, that means the kidney function is compromised, right? So those kind of things where you need a secondary or tertiary care, specialist care, they can take over it. But those who are very basic diabetic, hypertension, well controlled, it can be done by the GPs. Even slightly complicated, we can do it. And some of the patients have easier access to the GPs because why? The GP clinics, we are a community-based clinic, and we have the relationship with the patient. So right, then the the compliance and drug adherence will be much better because it's a personalized care we're giving. And the other thing is that we operate long hours. So when we operate long hours, even weekends, so this will give accessibility to the patient, convenient to the patient. So definitely this is something that we have been speaking for a long time. Definitely we need a political will from the government that they must just do it.
But with what you've said, I guess, and this may sound cliche or come across as cliche, but everyone, all stakeholders must come together to make this happen. And in your conversations with people in the government, people in the public sector or private sector, and also friends from insurance companies, what are their response to this with regards to? So we've got a pool of people. A lot of it is a pool of sick people who've gone into the system. Now creating a pool of healthy people and making sure they're insured.
Okay, I think
is it making sense?
Yeah, it makes sense. I think what is more, I think what is important in healthcare is that healthcare is an ecosystem, right? So when healthcare is an ecosystem, it is very important. We need to identify who are the players in the ecosystem. Okay, if you look at the private sector in this context, like what Gerard you asked me earlier, right? Okay, you have the doctors, the specialists who are providing the services, professional services. They need a facility, that hospital, to provide that services. For the hospital to function, they need to comply to the act and regulation by the government, and they need to make sure they have the latest equipment. They need to make sure they comply to the quality and standards, right? And then you have a payer. The payer could be the insurance, and the payer could be employers, and then you have a sizable portion who are out of pocket. So we can see from here, there are ecosystem: regulator, payer, operator, and the profession who are providing the services. So definitely all have to come together and sit down and see what are the pain points that everybody is having, because ultimately the entire ecosystem is built for one purpose, for the patient, to treat that patient, because we also can be the patient one day. So how are we going to develop a system that actually addresses all the stakeholders' issues? So I think that is what is very important. So that is why when designing something, it's very important for us to co-design something. So that is why, for example, for this, that's why we applaud the what do you call the government when they set up Jawatan Kuasa Bersama Menteri Kewangan and Kesihatan, Menteri Kewangan 2 and Kesihatan for this healthcare cost. That is a good initiative. For the first time, Ministry of Finance 2, Ministry of Finance and also Ministry of Health, together the Bank Negara Malaysia, stepping in to say that it is something that we must be done, and the only way to do it is that it must be collectively done. It must be co-designed. I think for that we have to applaud them for that. But having said that, no plan is a perfect plan. We have to start somewhere. So what is important that along the way, the design, we have to find tweak and to make sure the most important stakeholders here are the patients. They are protected. They are not financially burdened. So the system, whatever the proposal, has to be reviewed from time to time to make sure there is no financial burden to the patient, especially, and also in terms of the coverage. What is it covered? What is not covered? So
while that is happening, and you always hear these arguments of private healthcare is a lot more relaxed, or people are treated. There's a lot of time given to a patient in private healthcare. You don't see that in public healthcare. Now, I guess the defense to public healthcare is the volume, the sheer volume of people. Just go down the road to HKL, and it's frightening to see the volume of people or the number of people on a daily basis. Now, in your mind, I'm sure, or in your minds, I'm sure you have a sort of an approximation, an anggaran of what this healthcare, this insurance will look like. For most of us now are trying to figure out what's going to be on the table for all of us as Malaysians, as Rakyat Malaysia. But in your head, as the president of MMA, what do you see? What do you want to see there?
Okay, basically, I think one thing we must be very clear. This solution is fit for purpose. That means there was an issue of those who are having private insurance, and then they see an escalation of cost, and they also see an escalation in the premium. So the issue, the thing is, how do the government address the insurance financing part? So that was very focused. And because I think only 7.7 million Malaysians are having private insurance, and probably some of it could be also from the employers. So basically here, we need to have safeguard for these particular patients who are actually already taking this private insurance, or also those who may want to take private insurance. What are the safeguards for them? Is the premium? Will there be an escalating premium all the way? Will they be excluded about all the risk factors they're having? Okay, so these are the important things that we have to make sure the patients who are taking the insurance, they are protected by this. And also, whatever the premium, if they are above 60 years old, is it sustainable or not? So these are the areas, I think, to be fair, I mean, they're looking into that. And what the government has announced was also that there will be a review, they will be listening to the feedbacks, and also they will be during the POC. So they still have time for us to give feedbacks, to fine tune it, and ultimately it must serve the purpose of those who are already insured or those who are willing to take up the private insurance. But more importantly is that we should not lose our focus that the public health system needs to be well funded, needs to be protected, and then we all should make sure.
So well funded and sustainability.
Yes.
So it must be a good circular economy. And when you say well funded, how much are we looking at? Do we have a ballpark figure of? And I know I shouldn't be asking you about numbers at this point, but yeah.
Okay, Gerard, I think I would rather follow what has been discussed many years ago. So basically what MMA is looking is that there must be at least 5% from GDP to be spent for public health sector.
For us lay people, what does that mean? How much is that? Can you give us an example?
Okay, of the figure, I would say probably, I got to get the exact figure because exact
not a problem, just an approximation. Yeah,
probably around 70, 80 billion.
70, 80 billion, and that's something we should
double
be
the current funding that the government is giving.
Right.
So now the question is, where is the money going to come from? So that's a $1 million question that everybody is asking, right?
Right.
So that is where this is what the member of parliament should be debating in the parliament. How are we going to raise fund? Are we going towards a social health insurance, national health financing? How are we going to move towards that? So these are the conversations that MMA is expecting the member of parliaments to raise in the parliament, to raise continuously in the parliament, so that because healthcare should not be politicized. It should be a whole of nation and whole of city. It's everyone's responsibility. So at least if they keep on brainstorming this, okay, so then at least we can move forward.
Right.
So that is very important.
So we're looking at, I mean, everything going online, making sure data is there. We're also looking at this thing coming to life by 2027, or at least the first quarter of 2027. Now, with all these changes, and here's a bad word that's usually used in the medical fraternity, it's called dispensing separation, something we've been talking about a long time. Will that change?
Okay, dispensing separation. Okay, we had stakeholders engagement in 2015. So it was agreed that dispensing separation may happen when you have a national health financing. That means it's clearly defined. Everyone's role is defined. So until then, it's not possible to take place.
It's until then. So we need to see this through, and once this moves forward, everyone is sort of semi-insured, and then we can look at
and then you're talking about national health financing, and having said that, when you talk about dispensing separation, like most GPs, we have actually lost out the management of non-communicable disease drugs, medications. Okay, so many of the corporates have taken away and outsourced to certain big corporate pharmacies to manage that. So we have actually lost out a lot on NCD's management as well, and also teleconsulting. Medications are given without properly following what is the ethical guidelines. So those things are already happening in the sector, which is quite sad. Because ultimately, what is important is that whatever we do, we want the best for our patients. And NCD management is a long-term management. And then we must also understand in NCD management is a behavioral changes. 30% of social health determinants is your lifestyle, your lifestyle. So the continuous engagement with doctors is very important for that. Otherwise, we will going to see the number of cases with complications will be on the rise. I hope that there will be some studies coming out in the future to see the complication going up of the NCD. So when the complication goes up, of course, the cost of treatment for the complication also going to rise.
Yeah, it's interesting you say that, because this conversation can go many ways, and one of them is, you know, the use of newer drugs today, and you know how people are using or misusing them to lose weight. And I'm not going to mention the name of the drug. You know, everyone's buying it like they're buying chocolates from the store, the candy store down the road. Having said that, your message to policymakers with regards to what we need to think about when we put this whole insurance or national insurance together, I'd like to call it that.
Okay, I think what is important when they put a national health financing together, yeah, that is totally a different thing than what we were talking earlier, right? National health financing together, they need to have a statutory body that governing it. Okay, it should not be reporting to Prime Minister. What it should be an oversight. There should be an oversight how the funds are going to be managed, what is the cost of managing the fund. It must be not for profit. Okay, and how the funding is going to come in. So all these things must be very transparent. It must be very transparent. The accountability must be there, and there must be a very good governance structure must be there. So these are all the basic fundamentals that must be in place before even they implement it.
Right, and for all of us, every Malaysian who are going to be subscribing to this in some way, shape, or form, your message to all of us.
I think the message to Malaysians, I would say that healthcare is everyone's responsibility. It's not the government's responsibility alone. It's a whole of society, whole of nation, and every one of us must play an important role. At least we should start with drinking enough water, healthy food, exercise, good sleep. These are the basic things that all of us should be doing so that we always prevent from diseases taking place.
Right. I think I better start with that. Drink a little bit of water. And for many Malaysians, this isn't about policy, it's about whether they can seek treatment without fear of the bill. This is a conversation that Malaysia can't afford to get wrong. I'm GERARD Ratnam. Thank you for watching The Nation right here on Pradama TV. Thank you very much, Doctor.
Thank you.